validation.
All of it.
What is data validation? Data validation is the process of ensuring data is accurate, complete, consistent, meaningful before it is stored, processed, or exchanged between the system. Okay, so yeah, what is data? A group of information, we call it as data. Now, whatever the data I have, I need to do something called fact check. Okay, something called fact check, which means whether it is accurate or whether it is complete or whether it is consistent and whether it is meaningful. Okay, so that I can collect that information and store that information whenever required. I can process that information. In the same time, if somebody is required that information, I can exchange the information. Okay, so that's what data is for. Data is something, a group of information collected in one place, and when I do the data validation, it ensures whatever the data I collected, it is having some meaning. Okay, so we call it in general term, we used to tell like fact check. So something in day-to-day life, we are able to see so much AI generated informations, right? So even the audios, videos on the social media, we're able to see different type of AI generated images, AI generated videos, which you are not able to understand, or sometimes you are not able to recognize whether it is real or it is AI generated. That is how the data collections and data informations were used, and they started producing the informations and they started providing the informations as well. Okay, now, so to ensure whether whatever the data I have, whether it is really a data collected manually or the data which is been auto-generated. Even it is auto-generated, it is an well-stored information only. Okay, that's the reason now this data analysis and the data science and machine learning, these all are going into the peak. The main reason is like they are able to store lot of data because of the improved technology. So when it come for our informations and come for related to the medical coding, when it come to the healthcare sector, especially, so what are the information if you're going to collect and store and process or exchange between the hospital to hospital, provider to provider, provider to hospital, hospital to patient, or patient to provider, that need to have a accuracy and completeness and consistency, and it should provide some meaning. Okay, then only that will make a clear data validation. So the goal, prevent incorrect or unstable data from entering the system. So when I'm going to store a lot of information in one place, I cannot store some vague or ambiguous information. I need to store something, it is very clear and accurate information. That is where the data information is going to use. The same way how it can be related means all the patient informations. So whatever the treatment, services, exams, procedures, laboratory reports, okay, pre-registration, post-registration, demographies, whatever they're going to create, and those information will be stored in separate place. And before storing that, we need to do an fact check, which is also otherwise called as data validation. So now, based on that, we have one more term which is called error checking. Okay, these are the major terms. Okay, what we are discussing is data validation, but this error checking is, it is going to be a co-system. Okay, it is like it is related, but both have a lot of difference. Okay, as I said, those are like something we can tell like they are coexisting informations. Okay, so error checking identifies mistake after data enter or during the data transmission and ensures data integrity is maintained. So now the major difference is that before storing, we are going to verify whether the information is correct or not. So somehow I'm going to store the data. Sometime it can be a correct data, or sometime it can be a wrong data, whatever, incorrect data. Okay, so anything it can be. But between this good and bad, one step we are going to carry out. That step is called error checking. Okay, so during the entry of the data or transmitting the data or while maintaining the data, we have to do the error check. Error check means any mistakes. See, fact is different from the mistakes. In the fact, there will be a possibilities of mistakes where that mistakes can be removed. That is what, to control that mistakes only, what we are doing is like error check. Yes, this information is true. There is no doubt in that. Okay, this patient has taken this service, up to this service, that service. In that, maybe say for example, they might have performed a procedure. Okay, we'll consider like an MRI procedure is performed. Okay, MRI of with and without contrast is performed, and they injected contrast for the patient. Now this is the data, and this is a accurate data and complete data for the patient, and I'm going to store it. For future, I can process for the reimbursement, I can send it to the payer also in future. In between, I need to go back and verify whether it is whether the information, whether the service that is provided to the patient, really they provided the contrast. If they provided the contrast, how much of amount of contrast it is provided, and how much of the time it is been spent. Okay, so that will even more, it will ensure, so, okay, whatever the data is collected is accurate. Those kind of small kind of things, whatever that the mistakes need to be corrected there. See, sometimes doctor will document as supine position, and when we ask with the patient, he may tell, no, I was sleeping in the upright position, or he may tell like I was sitting in the decubitus position. So there, small see, the procedure is done, but there is a minor correction is there. Okay, sometimes when it is getting communicated, or when it is transcribing to from the now what is that mouth to documentation, this kind of errors may happen. So to do that, we have some step called error checking. Okay, detect and correct the errors that already existing. As I told, one example I provided for MRI, that is information already is there, but here and there small corrections I need to go and make because of the different set of information, different set of feedbacks I'm getting through the physician, or through the patient, or through the payer, or because of the guidelines, I may have kind of changes. So this is depending on the coding. I'm telling you the one example where this is vastly applied for all type of sector. Okay, that can be applied even in the manufacturing or R&D, or it is going to be a production place, wherever it is. These two things, data validation and error checking, is very, very important. Now, in the current AI technology, data validation is one of the part in the data science, whereas error checking has become the machine learning. Okay, so now both are combined and creating a different future. So it sounds like a small thing, but they're doing big, they're doing very huge changes in the entire environment. Okay, that is what the error check. The next thing is the key difference. Okay, so to keep something in the mind, even though I know the definition, what is the error check and what is data validation, I need to understand what is the key difference for that, so that I will be very clear what I'm doing. Okay, so data validation before data is saved. Okay, where error checking is after or during the process. Okay, that is a difference, small difference. As I told, MRI, where it is stored already, it is like what is it? Already the exam is already the procedure is performed. Okay, after performing the procedure, or after the documentation is created, during the process of creating, or after the process of creating the documentation, small corrections they may do. That is what a error check, and this is what a data validation prevents error, and this detects the error. It prevents the error, and this will detects the error. Keep that in the mind. That is a keyword. That is a key word I can tell. Prevent the errors and detect the errors. Example, date of birth cannot be future date. Yes, that is how we can prevent a super example. This is, see, we can keep it in the mind. Date of birth cannot be in the future date. Check some failure during the transmission. Okay, so if I'm going to enter the date of birth, there is no way I can change it. Okay, one good example in the current situation I can tell is like, say for example, if you're going to create an account in the Google, okay, say for Gmail or something you're going to create, if you're given the date of birth once, there is no way you can change the date of birth. There is a limitation. Okay, especially when you're giving a age lesser than 30 years. Again, if you wanted to change the date to 14 years or 15 years, you cannot do that. You have to know good. We have to go for step by step of process, or we have to completely delete the account and we have to create a new account. That is how the strict policy maintained by the Google. That is one of the example. You can keep it in the mind. Okay, which date of birth cannot be changed in future. Once it is set, that will be the date of birth. Because of based on date of birth only, we have so many codes, so many CPT codes, so many ICD codes, and so many PCS codes are there. So we cannot here and there keep changing after doing the procedure. Okay, that is what they're trying to tell you. The next is like, check some failure during the transmission. So what happens when I'm exchanging or moving the bulk of information, bulk of data? Okay, when I'm moving there, I may miss out few things. I may miss out some of the point. That is what they're trying to tell. Check some. So in a group of information, when I'm sharing, I may miss out to check certain informations there. That can be controlled or kept in the checkpoint, which is called error checking. Okay, so this is the common difference between the data validation and error checking. Hope you are able to understand how this differentiates data validation and error check. Right? We are good. Okay. So I'm going for the next point, that is a common type of data validation. Okay. So first is the format validation. So this kind of issues usually it happens with certain dates and the month. See, till we have 12 months, and 0 to 01 to 12 we have the date as well. Now if I put 0101, DD01, MM01, and here there is no issue. Now what happens? I cannot be very sure which is month, which is date when I'm using the US format. In India, I use DDMM format. When it comes for United States, they are using MMDD format. Even they're going to use MMDD format, some confusions may happen because of that. Okay, so there we need to be very careful when it comes for the format validation. Then next example I can tell on the ICD-10. Most of the people initially when I was taking the training, okay, when I give the assessments and all, they don't even use the decimals. If you don't use the decimals, how it is able to understand the code? If you don't use a decimals, it becomes a epic code. See, certain characters, when okay, certain codes, they will end up with the 5 characters. When it ending up with the 5 characters, say for example, the 1193, there is a code. There is a DME code in the epics. Okay, E1192, durable medical equipment code is there. If I don't use the decimal, entire format is getting changed. So that is one type of data validation where I can ensure. Sometimes I see people, they use the small alphabets. Okay, when the initial time of ICD-10 inaugurated, like established in 2015 and 16, during that time I see most of the people they were using, yeah, so what is that, instead of using the capital letter they were using the small letter. Even that becomes the format validation. Then range date, okay, yes, that's very very important. So nobody is going to live more than 120 years. Okay, so the age is going to be between this, and blood pressure limiter, certain reports, okay, glycemic, BMI, ground glass, and blood pressures, and this kind of laboratory related, okay, this test analysis and drug assays, pathological assays, this all comes with some limitations. Okay, so that limitation is it cannot go beyond that limitations. We'll have the range for that validation. And type validation, so type validation is like number versus numeric or integral versus decimal. Okay, so here what happens, so we should be very careful what we are typing there. Okay, sometimes we may type like say for example, coach, when they're typing, sometimes they use the alphabet in the end, sometimes they use the text in the beginning. So this kind of difference may come, so we need to be very careful. And I told about the decimals. So decimals and integers are very very important. Wherever the dot need to become, we are supposed to use the dot. Then presence mandatory field, okay, presence validation, which is like patient ID and provider NPA ID. This is all very very important, which we cannot leave it blank in the form. Without that, you cannot proceed the medical report. The length validation. So if CPT 5 digit means 5 digit, it should be there. It picks 1 letter plus 4 digit means it should be like that. You cannot just go ahead and use your own formats, and you cannot change the numbers or you cannot reduce the numbers. Okay, that is what a length validation will be done. Okay, then consistency validation. It is like gender versus procedure, diagnosis versus areas. For newborn, I need to use P code. Okay, for certain CPT procedures or certain procedures, say for example, trans-abdominal of trans-vaginal or pregnancy reports will be the ultrasound of pregnancy less than 14 weeks. For male patient, I cannot code that. Ultrasound of breast for male patient, I cannot be able to code. So I should be able to validate that whether it is the CPT is related to the gender specific. Okay, that is what a consistency validation. Okay, so common error check techniques. Okay, like how we are seeing for the data validation, we are seeing on the common error check techniques. One is like checking the digits, so medical record number, insurance ID, and second is like party checking. So party checking means ensure the correct number of the bit during the transmission. So by using this IP protocol and all, they used to transmit the informations. So it will be in encrypted format they will be using. In that scenario, I need to verify all the informations are provided with the correct number, correct bit or correct IP address. So that is what party checks we call it as. Checksum verifies the data integrity in a file transfer. So before sending any files, we need to ensure this is having the important information and correct information and accurate information. That is what checksum. Then duplicate detection. Yes, this is the most often we used to see in day-to-day life, especially in the coding sector, duplication. So we receive the addendum, we code it one more time. Whether we will not go back and analyze the original report with the addendum report, or sometime what happens, we will have the global periods. and sometimes what happens, repeated procedures might have done. So we don't indicate with the modifier. Sometimes we code the duplicates. This all can be stopped or this all can be controlled with the error checking techniques. Then audit trails, yes, it is always better to go 2 steps of audit check for each and everything whatever we are performing on day to day. Otherwise, we will end up with the low quality, and that will lead us to the complete losing of the project. Okay, that is what audit trails track who changed the data and when. So that need to be tracked always. Then data validation in healthcare IT system. So where and all it is used? Where and all this data validation in healthcare it is used? EHR system, HIE system. HIE system means Health Information Exchange. H means health. Always remember H means health. As I told for O office, here H means you can give 95% H for health. Okay, health, electronic health record. Otherwise, health information exchange. Okay, even I also 60 to 70% you can correlate like I means information. Okay, claim processing, billing and reimbursement, quality reporting. These all are the areas where this data validation is used. Okay, then example, ICD code must be matched the diagnosis type, invalid CPT ICD combination flags, missing modifier rejection, NPA validation before claiming. So if you have worked in a software named two important software where I came across out of like if 20 plus applications have different softwares have been worked. In that I would mark for 2 applications very good mark. One is an Optum CAC, the other one is like Imagine. Okay, if you see this both, you can keep a control of your LCD, you can keep a control of your CC edit, you can keep a control of your ICD decimals integrities, and you can keep a control of your CPT digits, length, characters. Okay, and you can keep a control of what is that your gender. Okay, it is like each and everything. If you do any mistake and if you try to accept the report for SARS, try to send the report for billing, it will immediately pop you up and it will provide you the information that somewhere you are missing. It is unbundled, bundled, LCD, NCD, okay, CC edit, MU edit. They even if you are going to miss the MIPS, merit-based incentive, incentive payment systems. So whatever the area, okay, what almost like I can say, especially this Optum is improvised and improved in such a manner so that the probability of errors are going to be 3 to 4%. Don't think like I'm advertising the Optum. That is a fact. I used to feel like, oh, anybody can code. For this, a 10th class person is sufficient. If he is going to know what is coding, if you know how to lead the code, automatically it is taking the CPT and everything. Only I need to do is like a cross value. It is like doing the audit. Instead of I cannot tell it is a coding, it is like doing it such a way it has been designed. Even if you see, imagine one step forward. One step forward, they have gone and they made a software in such a way so that you can be able to understand, even go before going to the billing, payer, primary insurance, secondary insurance, timing, global period, everything it is able to validate. There is a collaborated software like Optum and Imagine is getting collaborated, and they were using some of the projects where it is providing 98% of accuracy when it comes for the data validation, error check. All these things are completely fixed in that. You have to blindly read the report and code. Don't even worry about demography. Don't even worry about CPT, ICD, and gender and all. Just read the documentation and code. If you're making some mistake, it is going to pop you up. Such a way it is being improved. Okay, so like that, this data validation and the error check are going to be help you in a vast manner. Then importance in the medical coding and billing prevents claim denial. As I told, so many denials are reduced. Improves coding accuracy. Exactly as I told, manual power is completely reduced in that. Ensures HIPAA compliance. Yes, it will ensure all your gender specific and your informations, everything under the control, under the encryption. Then reduce the frauds and abuse. Yes, here you cannot manipulate anything. Upcoding, downcoding cannot be done because everything is prefixed in one place. Improves the clinical decision support. Yes, it will provide a clean information of the clinical related conditions. Okay, that is what importance in the medical coding and billing. Okay, so this is on the validation, data validation, and the error check. Okay, so for any